Welcome back to another episode of Wellness Collaborative. I'm Dustin Hawken, Wealth Advisor, OmniStar Financial Group, and I'm very excited to introduce our guest for you today, Dr. Joshua Dobstaff, President and CEO of Progress Medical. Welcome, Josh.
Thank you, sir. It's great to be here. We've been talking about doing this for a while, so I'm excited.
Yep, absolutely. Dr. Dobstaff has been practicing medicine for over a decade, and he's recently opened a new practice here in Wilmington. Dr. Dobstaff, I think our viewers would really enjoy hearing more about your journey into medicine, how you got started, and what makes you so passionate about medicine in general.
Honestly, I've wanted to be a doctor for as long as I've known, ever since I was a little kid, to be honest with you. And so there's a sort of a family tradition of doctors in my family. I thought it would be something that I would really enjoy. I love talking to people. I've always liked being around people. Once I've got into the business of trying to really help people, then I could sort of feel that passion sort of brewing, and it really kind of culminated into something that I wanted to make a career out of. Through undergrad and medical school and everything like that, then the next step really was to sort of determine what aspects of medicine I wanted to go into. And for me, that was kind of difficult because, there's so many areas of medicine. There's so many different subspecialties and specialties that we can get into. So I ended up not necessarily knowing specifically what to do. I decided to take sort of a broader track that we call internal medicine. And that really kind of allows me to focus on a lot of different organ systems, really the whole body, if we think about it that way. And in doing that, I get to know a lot about all aspects of the body without sort of specializing in one particular field. When I finished internal medicine residency, I sort of had to make this decision about whether or not to specialize or, kind of stick within that track. And I worked in hospitals for quite a while, something called a hospitalist. And I've been doing that for pretty much the past 10 years until I decided to start Progress Medical. I've always been passionate about, patients regardless of where they are, if they're inside the hospital or not. But I really have seen myself transition away from the inpatient setting and try to identify what I think an ideal practice would look like to me. And that's sort of how, Progress Medical started and how it's came to evolve into what it is now. And so, it's sort of an exciting time, and in terms of me being able to kind of mold that into however I want it to be, based on not only what patients want and need, but what I think they're going to need as we move forward in this kind of phase of medical care and what I think people really are interested in.
Mm-hmm. Well, in your expertise, it's really the whole body. And what we've been talking about a lot with the medical professionals and the groups that we're a part of is everything's connected to another piece of the body. And so for you to be so well-rounded everywhere, that gives you a big advantage. Yeah,
and it's kind of interesting because, like I said, internal medicine, that's a traditional approach to medicine that's been around for a little while. But to me, you think about, some other aspects of medicine, especially kind of post-COVID. I sort of feel like there's sort of a little bit of a shift. And not only how we should be approaching care to patients, but how patients approach their own medical care. Mm-hmm. And, I think they do think in broader terms, in terms of what we call like alternative medicine or holistic medicine, other therapies outside of here's a pill, take it kind of thing. And it's not entirely what we were trained to do in the internal medicine arena, but there's a lot of that, and I don't think that's entirely the answer, because I've seen it plenty of times in the hospitals where it did not work. And I think that there's other ways to approach preventative medicine and, still that whole body approach that we do see through more alternative types of measures and treatments. Part of my ideal is to combine it all, because there are plenty of aspects of internal medicine that are very useful, of course, but I think that there's also another side to it that we need to blend together to provide better care.
Mm-hmm. And this has given you the motivation to start Progress Medical here in Wilmington and your own practice, your own specialty practice, and so merging those two has really the vision and the why?
Yeah, that's kind of how it's come to be at this point. It's interesting that, we're calling this a wellness collaborative, because wellness is actually, it's a term that comes up often when I sort of think about what Progress Medical is. Wellness is a very broad term. It means different things to different people. But, by me setting up my own practice, I can sort of identify what I think wellness is and how we get there, and then, develop programs that allow us to do just that.
So speaking of wellness specifically, what types of things are you doing in your practice to be different?
We want to center it around still some good primary care services. And I've sort of created a concierge wellness model that I think would benefit patients the most. And by doing concierge, it allows me to have more access to the patient and vice versa, and allows a lot more time with each other as well. And so that's going to be the sort of the mainstay that allows me to sort of deliver my model of sort of a blended internal medicine, functional medicine type of characteristic to patients. But, in my experience through other partnerships and medical directorships that I've had across the state, I've learned a lot more about, other arenas that aren't fully in the mainstream, aren't fully touched on. One of them is hormone replacement therapy that I've become actually quite passionate about over the past few years. Largely because there's a lot of misnomers and miseducation surrounding hormone replacement and what the good and the bad and all those things in between. And so I get really excited about digging into sort of the research behind it, what works well, what I shy away from, and then be able to deliver that to the patients so that we can optimize their hormones and really make them feel so much better about them, how they're feeling physically, mentally, emotionally. It just helps in so many different aspects of their lives. It ties in well with medical weight loss. It's also something that I've become very passionate about. So we have different programs that, allow medicine to sort of facilitate a well-structured diet and exercise program to deliver optimal weight loss benefits to the patient. And so a lot of times those last two go hand in hand. And then, so part of the evolution of the practice, it was like, well, we've gotten good weight loss results, and you almost see, some of the fat loss, the loose skin in various areas, even in the face. And so we started getting more into an aesthetic type of arena to help sort of counter those, effects of optimal weight loss. Sort of a good problem to have, right? Mm-hmm. But I'm not a surgeon, so I'm not going to be doing anything along those lines, but there are plenty of good non-surgical options out there to help with, body contouring, for example, and sort of reducing fat in certain areas, or even doing things in the face. So we've gotten into, we use machines called InMode that use radio frequency that helps melt fat, whether it's on the face or the body. It introduces radio frequency energy that kind of causes a little bit of damage underneath the skin, but in the healing process, builds new collagen formation, so it smooths out fine lines and wrinkles, things like that, and then kind of helps sort of keep that youthful look. And then, of course, then we started segueing into, okay, when we start doing what we call toxins, so, Botox is the most well-known, but there's other ones out there that we use. It's sort of just kind of building on each other. So every program or, service that we have sort of overlaps enough with the next one that we have something to offer. And so we just kind of keep it going that way. And the last one I'll mention is IV hydration. So I've worked on, developing good IV hydration recipes, if you will, or cocktails that sort of help with whether it's performance and recovery. There's always the hangover one, of course. But there's other ones that, help with immunity. We've got one called Inner Beauty, and things like that. There's even things in the anti-aging space that are really, really cool. So there's a lot of infusions tied to that. I love the anti-aging space.
Tell me a little bit about the patient that you're looking for, or maybe the patient that doesn't know they need you. Who is that person, and who comes through the door and you're like, okay, we're going to have a great partnership?
Yeah, right. As much as I'm internal medicine trained, I am not the type of doctor that just hands out pills. I do like to, take a sort of a unified approach to your care so that we can identify programs that are going to allow you to, still be the best version of yourself without focusing solely on pills. Now, that being said, there are times where medicine is helpful. My weight loss program is based on medicine but it's also in addition to those other aspects, the exercise and the diet. So you really want to come in motivated to make those changes. And some of those habits are hard to break. I'm as guilty with it as anybody else. And, if we work together, then we can sort of drive the results that we really need, that we're really looking to make.
And no, it's well said, because we see it in financial planning as well, where people want to make all these changes in the course of 1 or 2 or 3 meetings, but it takes time to get on track.
Sure.
And build those habits. And what I like to have people do sometimes is say if we've been working together for a year and a half, and they don't feel like they're quite where they want to be yet, which is normal, because there's a lot of changes that need to be made. It's, hey, think about a year ago where you were, and think about the progress that we've made so far. So I think it's a fitting name.
Yeah, and it's, like I said, it's never linear. I mean, even progress, I have a physical office space now. This started out of my home office, so if I ever feel flustered with my own progress in building this practice, then I have to kind of sit back and think about it. And it's no different with somebody's weight loss journey or wellness journey or whatever it is. It's a journey, and it's going to take time, and it's not something that, I found that if you get instantaneous results, then it's usually not going to last. And so if we build a good foundation and the right practices, that you start really noticing a difference.
And it snowballs. Once you start seeing the results, then it makes you want to do it even more.
That's right.
And especially when they partner up with someone like you, personal trainer, and they have this great team around them.
That's right.
So tell me a little about that. Right before we started shooting, you were talking to someone, and he mentioned his personal trainer, so you're going to work or coordinate with him. Is that something that you do quite often?
Yeah, actually, we're working on outreach to the community, and because there's still a lot of, I think, businesses that we can partner with that don't know quite yet that we're here. There's a mutual benefit there, right? If they have somebody that obviously they can motivate them to come into the gym and exercise, but doesn't necessarily help when they go home and eat a burger or whatever it is. So like we need maybe a dietitian or a nutritionist to keep them accountable there, and then I can kind of manage the medical aspects, so it kind of comes full circle. And so that makes all of our jobs maybe just that much easier, because now we're all kind of working in conjunction.
You look at any successful company or any successful business, there's multiple people doing different things.
Yeah.
There's an expert in every area.
Sure.
And there's not one person who's an expert at all areas.
Right.
And it's the same with someone's fitness journey. Having the right person here and here and here,
Yeah.
that's how you're going to get the best results.
Yeah, you need a team approach, really. And you're right, with business, that's what I learned very early on, is when I was starting this by myself out of my office. I was learning the main thing I lacked was team members to help me get this going. And it was only over time, when I found the right team members who are great, then all of a sudden it's like, okay, this thing is really starting to take off.
So speaking of team, there's commonly blind spots, and the same thing with financial planning, that people just don't know what they don't know. And so what are you seeing now with your clients that maybe just Wilmington or people around the state just don't know that Progress Medical can help?
We're seeing an issue with access. Patients having access to care in a timely, not only a timely manner, although that is a big issue, because I don't know how many times I hear, I want to set up an appointment with my provider, but they're booked for like a month out, whatever it is.
So true.
And even if they are they getting quality care when they're there? Because a lot of it, if you're based solely on an insurance model, unfortunately, you're kind of stuck in a pattern of restricted time frames with patients. And I don't know how you can do a quality visit in 15 minutes. I just don't do it if I can help it at all. Education sort of touched on, how there's a little bit of miseducation on hormone optimization, for example. So I love talking a little bit more about that. I've done sort of seminars with folks and invite people in and do presentations about hormones or, our weight loss programs or any other aspects to just get the word out there and make sure, they're hearing the right type of information that's backed by science, that's been well reported. And that makes them feel better that they're getting, sort of optimal care and making well-informed decisions about their health. I don't like sticking down one track where this is how we should go, because that's not how everybody thinks, I feel like we turn people away by saying, just do this. That's the only way. And it's the same with diet, for example. Like I'm never gonna just say, only do keto or Mediterranean, whatever. I give them every option they have, and then we can tailor their dietary approach to a regimen that they choose.
Easier to stick with it too if they feel like they're creating some of the plan and it's things that they like, as opposed to you just saying, hey, leaves and vegetables for the rest of your life.
Right, yeah, this is the only way to do it. Never eat this one thing again. If somebody told me I could never eat a pretzel again, I would walk away immediately. It's just not gonna happen. So yeah, those are some of the things. There's probably more, and but that's what I like about having the practice, because then I can kind of drive some of that and identify where those blind spots are, and then we can sort of tackle it and shed light on it, if you will.
So when you talk about the medical landscape today, these 15-minute visits that take you 30 to 60 days to schedule versus your concierge service, it seems like it's complete opposite.
Concierge is a concept that's coming up more and more. I think you'll see that popping up a lot, because people are starting to see that maybe that more traditional route isn't quite offering the patient as much as they would like. And that's not to say it's necessarily the doctor's fault. There's amazing doctors in this area that, understand that, they're trying to play the game as best they can and trying to give, the best care they can in a somewhat restricted fashion. Everybody can point fingers on why that's to blame, but it's sort of led to the emergence of this concierge feel. And really what concierge is, access is a key term in that, because we want to make sure they can have access to us essentially all hours of the day. If we get a call in the middle of the night, if we can sort of help navigate that issue and maybe prevent a visit to the emergency room or something, and to get that patient in sooner the next day. These are all concierge type things. Now, concierge, typically involves more of a cash pay type of service. It's usually based on a monthly fee, and so it may not necessarily be for everyone, but I'm trying to create more of a tiered structure that allows it to be a little bit more flexible. So hopefully we can still offer that to people that may say, well, what if I don't need it as often?
Yeah, it sounds really first class, luxury service almost, where you pay a monthly fee, but they have access to you or your team at any point in time whenever they need it, and they don't have to go make an appointment through a hospital for 1 to 2 months out.
Right, yeah, that's really the goal, is try to keep it as first class, that's a good way to put it. Yeah.
And I think it's a great structure because, let's be honest, everybody can use some help with their health.
There's a lot of people that work out every single day, and the older we get, the harder it is to see the differences that maybe we used to see when we were 20, right? There is a reason for that. And a lot of it is, hormonally based. Everything from libido to, you're preserving muscle mass and maintaining bone density. There's people that are in their 80s that get, that could benefit from hormones. There's studies that came out recently that showed how much it improves their bone density and reduces their risk of fractures as they get older, So it doesn't mean I go and say, identify every 80-year-old out there and say that you should do this, but there are specific times and indications where that might actually help. And if the patient is open to that and is aware that that exists, is educated on that, and makes that decision for themselves, and why not? If you're in your 30s or 40s, or as we get into age or menopause for women, there's something that can help. There's nothing that says We have to just take it, you know, other than our own mind sort of telling us that because of kind of how we feel. But we can tweak that. We can almost reverse that in certain cases. And I mean, it is possible. And so that's kind of where I sort of see it continuing to go, is sort of more and more into that anti-aging space and really true preventative care, which would be really kind of a neat field to get into.
It reminds me of like the fountain of youth.
Yeah, right. Yeah,
you know, really, you just
be great to find that, right?
Yeah, exactly. And
Right.
this is one way to find it.
There's truly our chronological age, you know, how old we are. I'm 43. There's also a biological age. We can look at genetic markers within your own DNA to determine what your biological age is. So I may be 43, but biologically, am I 53? Am I 35? I mean, you can actually do tests that determine that, and then you can create programs that sort of tweak that, check it again, and see how you're improving.
So you do these tests that you're talking about. I feel like that is worth the price of admission right there. I would love to know what my biological age is.
Yeah, absolutely. No, absolutely. They're available through us, and we're actually partnering with other businesses that, you know, focus on this kind of aspect of healthcare as well.
Yeah, but it's been very impressive seeing you so far.
Thank you. Yeah. Well,
as we wrap up, what are some final thoughts or final takeaways? What do you think the most important things about Progress Medical for all of our viewers here in Wilmington are?
we're just excited. We're excited to be here. We're excited to be getting started. This has been kind of a couple of years in the making for me. So it's cool to be here and have this physical location and you know, kind of be able to have this type of outreach to the community and even continually shape what my definition of wellness is and allow that, you know, allow me to deliver that to people.
Well, certainly appreciate you coming in and sharing your journey, your vision and your mission for your business. I know that you're going to make a very large impact here in Wilmington, and you're already having a large impact based on the reviews that we've seen. So I know here at OmniStar, we're extremely excited for your business and what you're going to do for the community.
Thank you so much. It was awesome being here. I appreciate you inviting me to talk about it. Hope we can do it again sometime.
Absolutely. Please make sure you like, share, subscribe to our YouTube channel, Facebook, Instagram, all that good stuff. We're going to have a new playlist called Wellness Collaborative. We're going to be talking to other practices like Dr. Dobstaff's practice. Also, make sure you go to Dr. Dobstaff's website at www.progressmedical.com. Talk to him for a free initial consultation. He's going to have a major impact here in the community with this concierge service, certainly a step up from your normal 30, 60-day out, 15-minute appointment with the doctor, and it can really make a difference for you. Thank you so much for tuning in.